Are you looking for awareness, motivation, inspiration, or just some feel-good talk radio? If so, you've come to the right place. Dr. Nancy knows how to do just that. With her extensive experience and knowledge, she is dedicated to providing care, health, and wellness information and education to the greater Phoenix metropolitan area and beyond. Be the change you wish to see in the world. Dr. Nancy knows. Starts now.
Good morning, Saturday morning, everyone. It's Dr. Nancy Gaines on Dr. Nancy Knows Radio Talk Show. Thanks for having me and thanks for joining me today. Remember, you can listen via my live stream at drnancyknows.com, Emotion Radio, as well as entremujeresradio.com as well. Thank you. Today, I just wanted to talk about how grateful I am to have another day, to be blessed to deliver information that I feel that can be of use to many people. And I'm so grateful to be able to have this platform in order to deliver this message. Usually I like to talk about the structure of the format of our show, and we typically will talk about how important it is to tune in and get information that is really delivered through expert guests that we invite on the show, in addition to celebrity guests that will be here on a monthly basis. So we cannot wait to tell you of more to come on those guests. Today we are featuring our expert guest, Gwendolyn Snipes Jones, and she's a life coach. Yes, and she has over 20 years of experience, so we will get to know her a little bit later in the show. But Gwen will be talking about how important it is to communicate as parents to our children, and how important that family unit and bond is really a grave time for us right now, because as a nation, as a country, we found ourselves in a situation that is really new to us in many respects. But the human species is very resilient, and we're going to talk about the goodness and the great things that have come out of all of this as well, and continue to do so. Not to forget that it is Cancer Awareness Month as well, and to remember that breast screening, mammographies are important, and self-breast exams as well. And if you're not doing that, you should do that as well. We do have my co-host here, Gloria Guerrara, here today on every show, and she will be bringing to you our empowerment moment as well. And that will be moments that are relatable to the topics that we are talking about, and it could really bring more realness to the things that we are delivering in a way everyone can use as well. Remember, with me, Dr. Nancy's integrative medicine and the years of experience that I have had, 24 now, going on 25, multiple specialties in family medicine, emergency medicine. I've worked in trauma as well. The last 10 years of my career is emergency medicine and trauma. And now I have my own clinics here in Scottsdale, Arizona, two to be exact, where I deliver integrative, holistic wellness treatment modalities to all parties that seek out my services. It's really about mind, body, and soul. And my idea is when you walk in to our services and our clinics to deliver or request our services, you walk out with a greater sense of knowledge, understanding, and feeling empowered as well. So I hope that what Dr. Nancy Knows delivers to you is motivational and inspirational. The other things that I enjoy doing too is philanthropic work, and how COVID has been really near and dear to me with regards to our underprivileged populations, the homeless and the veterans, and how I have worked with celebrities in the past, specifically our last inaugural guest, Nick Lowry, the Kansas City Chief Hall of Famer. We have done several philanthropic get-togethers throughout the state here of Maricopa County prior to the state being closed down. So one of the many things that I like to do is give back. And we are talking about how impactful COVID has been on our nation's families and how resilient the human species is, and how important it is to actually prepare yourself for tragedies. It's something that does happen, and Gloria Guerrera specializes in insurance, and she has her own practice and business, GNG PHP, and she specializes in all types of insurances, particularly in this time that we are experiencing COVID and a lot of devastation and death. Is your insurance policies up to date and current? Living will or power of attorney? How about disability? Because there's been lots of layoffs and unemployment nationwide, and you don't have to suffer. So there is help out there. And I truly believe that sometimes you don't know what you don't know, and we are here to deliver information to you with resources that you can tap into here locally and also internationally and nationally. If it's not our team or specialties or specialists that I have as guests on the show, reach out locally to where you are as well. But being prepared is oftentimes what they say is half the battle. One of my mottos is be the change that you wish to see in the world, and it really just takes one person that you can impact their life for many years to come. The information that I deliver is not really for me to keep. It's for me to spread out, and you tell someone else, tell your loved ones, tell your friends. We are here to be humble servants in the community and answer any questions, or if you have any upcoming topics that you'd like Dr. Nancy Nose to have on the show as guest, or topics that you'd like to cover, feel free. Remember, we are being live streamed on Facebook as well, so type in your questions too. Gloria?
Oh, Dr. Nancy, I'm very pleased to be here. Thank you again. And you're absolutely right. Right now, every day, actually with my kids, every day we wake up or we go to bed. We are thankful because every day it's a gift, and you try to do the best that you can with that gift, and also take care of oneself and take care of the people that we can share our gods and talents. And yes, all the knowledge we talked a little bit of the other day, last show, all your years of experience. But one of the things that calls my attention that maybe we didn't talk about is, like you said, Dr. Nancy, integrative medicine, but what does integrative medicine means?
That's a very good question. Integrative medicine or treatment modalities simply include or mean that your healthcare provider is open to other ways to treat conditions. There is more than one way to treat medical conditions, and I get to the bottom of all of that. I did swear an oath, and I was practiced and educated Western medicine, but I have Cherokee Indian, and so I have a knowledge of also what it's like to also treat ailments or conditions by herbs and spices and plant-based. There are many different ways to get to the bottom of and or solve health issues and concerns, and I'd like to ultimately treat them in the most nutritional and healthiest ways possible. Now, I'm not saying that there is no place for Western medicine, prescription medication. There is. However, if it were you, would you like to optimize your health and wellness the most naturally way possible? Well, if so, I do that kind of thing.
Okay, so integrative, like in summary, is like to treat anything from your body and mind the most natural way. And you're absolutely right, because sometimes you can take one medication and then we have the side effects, and then we need to take another medication to cover for those side effects, and then it's like a never-ending story. So, no, definitely. And supplements, I can tell you that, for example, every day, I know I went with you and you recommended some isotonics with all the vitamins. It's very powerful. And even you take it every day. So when you recommended me that, can you believe that if I forget to take it, I feel the difference?
Absolutely.
I mean, it's like 6 is like, okay. But however, I see you all the time with the energy of a 12-year-old. So I want that energy, right?
Absolutely. So the supplementation that Gloria is mentioning and talking about is isotonics, and it's a patented formulation that is a powdered supplement. When mixed with water, it actually becomes pH balanced, very similar to your intracellular fluid. And when you drink your supplements, it's 95% bioavailable. As you may or may not know, supplements over the counter, all supplements are not created the same, and they can be filled with binders, coatings, these kinds of things that make it very hard to digest. And supplements by pill version really do have to be digested through the stomach, and the stomach has these hydrochloric acids. And so you really only get about 35-40% of what you take. Now the isotonic delivery system, it's 95% bioavailable.
So, so can we conclude that if you take the powder, the supplementation in powder, dissolve it in water, which is easier sometimes, it's like we gag when we are swallowing. You are looking for the small, small capsules. Because as people age, inside the throat changes too, right?
It really does.
So, but also the body absorbs more. So I can take 10 capsules and I'm only absorbing like 30%. And I can take one package of my supplementation according to your recommendation, and it will be 90% absorbed.
Absolutely.
Okay.
Yes,
Oh, that's
definitely.
great.
And that the same goes for alternative treatment modalities such as essential oils as well. And we have really great skincare products that are formulated with the most natural ingredients as well. And it's really all about preserving yourself and actually reversing the signs of aging. That is very key.
So it's like aging gracefully. And okay, integrative medicine, treating things a more natural way. But I understand you also have some secret treatments to get people more beautiful and better, right? What is that?
We do. We have regenerative cell therapies. And did you know that I could draw your own blood and spin it down into this product called platelet-rich plasma? And we can use that serum for your face for anti-aging. We can inject that serum into your joints to help with chronic pain and degenerative joint disease as well. Yes, wonderful.
Oh no, that's fantastic. So, and what about also that you have some, I remember when we were doing, which by the way, Samira, we say hi because your open house was beautiful last Saturday. But I remember Gary, the founder of Profit, mentioned that people can lose 2 inches of fat, and that you have that treatment. So I want to know about it because we have a lot of requests. Christian Acosta, for example, is like, I want to know about that. So how does that work?
So Profit Laser Lipo, Gary Charlson will be our next week's guest, expert guest, and he will be on the show to tell us all about it, but I will give you a little bit of information regarding this. It's state-of-the-art technology, uses red light in 3 different frequencies, nanometers, to penetrate the fat cell and empty it out. And so that's permanent loss of fat from the cell. So it's body contouring, inch loss, and used for spot treatment along with fading stretch mark lines and anti-aging lines and tightening of the skin. So it's very natural.
So if people are watching, it's like if you have stretch marks, if you have that little piece of fat that I think that I will never get rid of, I just need to reach out to Dr. Nancy. Well, it's great.
Absolutely.
Dr. Nancy always knows, right? And it's not who you know, it's not what you know, but it's also who you know, right?
Absolutely.
Okay.
Absolutely.
No, it's fantastic that you're a person of relationships, and it's great. And what about I saw that there was a lady giving massages a week ago. So do you offer massage too? What? Tell me what you offer and what you don't offer.
Well, I tell you, it is a one-stop shop, and really, ultimately, when you encounter services at Dr. Nancy's Integrative Medicine, I have a licensed massage therapy that does different techniques, myofascial, releasing, lymphatic drainage. We also do gastric drainage to help with those individuals that have stomach problems too. So when you come in, you can be rest assured that if you just tell me what it is and our staff what it is that you need fixing, we've got something for you.
So the first thing, people go with you and you do like an exam or a test, a diagnosis of where are you. You take blood tests to see how the organs are working, right?
I do.
And then based on that, you start like a dental treatment. You start a treatment so that you can be your best.
Yeah, it's a treatment protocol specific for you. If you come in and you make an appointment, it normally starts with me for your health screening, because health prevention and maintenance is key. You don't want to ever find out that you have something that you could have easily prevented. So seeing a healthcare provider once a year is really essential for continued health and wellness. So you sit down with me, we talk about different things that you have set for yourself, or concerns and issues, and we set goals for you to obtain, and I develop a treatment plan specific for you.
Is that right? There's a
Yes.
health screening. Because just in a little bit, at 12 o'clock, we're going to have the grand opening of Dr. Nancy's one of your clinics. But I was looking there that it says $199 for a health screening with you, and it includes the blood exam.
It really does. It includes everything that you would really need to jumpstart maintaining good health. So a CBC, a chemistry panel. So we'll check you for pre-diabetes, your cholesterol levels to make sure that there's no signs of infection. Absolutely, yes.
Perfect. Well, no, it's like also, well, on this inauguration, I know 3 hours. We can wait, right? Because we're going to have some different guests. We're going to have Nick Lowry there also signing some autographs. He's just going to be there for a small window, like from 12 to 12:30. So if you want to catch him, it's first come, first serve, because he will only have a few of those. That's one. I understand you're going to have masks as well for everyone. With the Dr. Nancy Knows logo, right?
Dr. Nancy Knows logo, yes.
Perfect. So we're, I have even here I can show that I have my mask already. I'm already preparing in about 3 hours, because we're following the CDC guidelines, and it's going to be open, and we only are going to have a small group of people. But we need to stop, because we need to go to some commercials. And remember, it's not what Dr. Nancy knows, it's who she knows. And we'll come back after a brief pause.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment, or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnancysintegrativemedicine.com.
At Atención, dueños de pequeños negocios. Soy Gloria Guerra de Bilingual Insurance and HR Solutions. Seré su mejor aliada al elegir el paquete de beneficios que garantice la seguridad de sus empleados y sus familias. Planes de retiro, nómina y mucho más. Llamando al 623-249-4548. Gloria Guerra, Bilingual Insurance and HR Solutions, el aliado que su negocio necesita para triunfar. 623-249-4548.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
We are back from a brief break, and we left off at, I'm having a grand opening at one of my Scottsdale clinics here later today, and we are actually going to be offering the COVID test as well. It's a rapid COVID test. We're offering a flu vaccine as
Excuse
well.
me, COVID test, rapid COVID test. Sorry to interrupt you. What do you mean by rapid COVID test? Because I was reading today in a big chain, a big wholesaler chain, that you have kids and you need to draw blood and then they need to get back and it's quick, it's 3 days. So when you mean quick, what's the turnaround?
I mean 10 minutes, and you come in, you want the test, we tell you, explain the test to you, we take a sample of your blood, and you get instant same day.
Oh, that's great. And is there a timing of exposure? Like if I think I met with Gary and I thought Gary has COVID, how many days do I have to wait to see if I have COVID or not?
It's a very, very good question, Gloria. Now, listen, for later today's grand opening, I will be featuring the rapid antibody test. And the rapid antibody test is a test that will pick up a potential exposure to COVID within 2 to 3 days of your contact. Now, and that's a rapid antibody test. I do also, with the exception of later today's grand opening, I also have the rapid antigen nose test. You will be able to get the results same visit in 15 minutes as well. So if that's something that someone is looking for, the antigen nose test is a molecular test. It will tell you if you have COVID as recent as exposure within the last 24 hours.
So I can go with the nose way.
You can. You can, and I'm very gentle, guys.
Oh, okay. No, that's good. And you were also saying, while you were saying COVID, you were saying, I interrupted you, but flu shots, is that right?
We will have a select few of flu vaccines. It will be the nasal spray because some people do not care for the injection, the needles, but we will have that available to you at the grand opening later this afternoon as well. It's from 12 to 4 at the East Bell Road location, Suite 204. And we, yes, correctly, Gloria, we are practicing and following the CDC and state guidelines. Everyone will be masked. It is not, it's a very intimate setting, and it's well controlled about who's coming in and who's not. We will have that very well regulated.
Oh, no, that's good. And no, I'm excited. And I got here a request. They want to know who was the winner of last week winner.
It was Kari Sadler.
Kari Sadler, congratulations,
Yes!
Kari. You get like a free wellness screen with Dr. Nancy, and you know that's like $250. So, Kari, if you're coming tomorrow for the grand opening, maybe that would be not tomorrow, tonight, at 12 o'clock here. That can be. If you
can
go,
set your
you can
appointment
take
up.
care of set of appointment. Yes, absolutely. It's like, no. And what are we going to raffle today?
Oh, today we are raffling a rapid COVID test.
Okay, and a rapid COVID test, for example, I was seeing competitors, it's about like $200.
Well, it is. It ranges from 150 to 195, depending on which rapid COVID test is asked or requested for. So we are giving away the rapid COVID antibody test valued at $150.
So, if you are watching and you want to know if you have COVID or not, or you have been exposed or not, remember to share this program with as many friends as you can, and just answer some questions about, like, okay, I'm here, I'm the first one, I'm interested in the COVID test, and probably can go in person in about 3 hours, because you say it's in the Bell location, which I'm excited, right? Because you're preparing a lot of stuff, so that's good. And well, on the other side, when you were saying about, let's go to the reality. The reality, you were talking about insurance a little bit ago, and thank you. Yes, I have been doing benefits and insurance for individuals and families for the last 19 years, and give classes in, I don't know, Local First, Univision, Telemundo, have helped with Entre Mujeres, Regina Duran, different people, and things happen. Yes. There's two things that for sure are going to happen in our lives. We need to pay taxes, and hopefully all of us die until we're 100 years old, right? By going to your clinic, right?
Oh, absolutely. We will extend your life, or you have a
Yeah.
great possibility of extending your life. There's no guarantees in life, though.
Yes.
But
But sometimes people, especially in the multicultural community, they say, oh, insurance, oh, I don't need insurance. I don't want to leave it to the Sancho. I don't want to leave it to my spouse. They can take care of it. But the idea is that they need to put the whole, or they need to cremate the person. And it's sad that we're looking every weekend, especially right now during COVID season, is like we're seeing a lot of people doing car washes or taquizas, or they are doing groups of donation or GoFundMe, and there's no need to do that. Sometimes, I don't know, you have a phone, right? And you have a phone here at the back, and do we have insurance on the phone? I mean, the phone may be $1,000, and I pay $15 of insurance. Why not pay $15 for my whole life? How much do I value my life? So this COVID test has brought COVID situation has brought a lot of awareness to people about take care of yourself. And if you have a policy, an insurance policy, okay, we'll give you a free look. We can go on site on the different offices of Dr. Nancy in Scottsdale, or you prefer on the north, we can go into the north or in the west. So we are, just like you custom made a wellness exam, we custom made like a financial exam, because like you said, the people need to have a trust. And I love to help the special needs families, and they need to follow certain protocols so that those kids keep getting benefits when parents are not there. But talking about like COVID and the Cancer Awareness Month that you mentioned, is like, can you tell me a little about our guest, because she specializes in how to talk to families about hard topics.
absolutely. And I do want to say one thing. The two things that you said, when people will invest in, you're going to pay taxes and, live to 120 years old. But the other thing too, as well, to actually prolong a great healthy lifestyle, is investing in your health, because you're either going to invest in one of two things, your health or your illness. And if you start now, and it's all about prevention and maintenance and reversing the signs and reversing that clock, start now. It's never too late. Why put off what you can do today, tomorrow, right? And yes, a great segue with introducing my expert guest. And yes, it's Gwendolyn Snipes Jones, and she has over 20 years of experience as in dealing with children, their parents, mostly parents in the relationships that they have with their children. She has her bachelor's from Pace University, and she flew in from San Diego to grace us with the knowledge and expertise that she has to impart on all of our viewers. I don't have children, but what she's got to say, I am ready to listen to.
Oh, no, we are your children. We want to look young, so you need to take care of us, right?
Exactly. So let's get to know Gwen a little bit, actually. Gwen, can you tell us a little bit about you?
Sure. Thank you very much for having me, and it's a pleasure meeting you, Gloria.
Thank you.
As far as coaching is concerned, I started coaching with family members, where they would come and they would ask questions, because the one thing about coaching is that you have to be a good listener. And I was fortunate enough to be raised by 3 mothers. And every mother has their own way of raising you, but my original mom, my birth mom, she taught me how to listen. My godmother, she taught me how to give, and my other mother, she taught me how to be there for people. And throughout my life of coaching, 20 years ago, coaching was not even a word to me. It was something that was told to me later on in life, that this is what you do. And I'm like, really? I do it automatically, So when I started with my, I call them my adopted children. I inherited 2 children. I actually learned from them on how to communicate, because as a parent, we're all raised in different fashions, and we all raise children differently. I found out that the way my mother and father raised me was not going to work for the kids that I was raising, because it was a different time.
So there's not a book that says how to be a mom.
That was my next thing. I was going to ask, I do have a lunch and learn workshop, and I was going to ask how many parents actually left the hospital with a manual. You don't. They don't give you a manual. They don't explain to you what you do next. So you actually have to establish your own book. Parents don't realize they are authors by themselves. They have to feel out and get to know their children.
So that mother instinct, that is like what to do. Because sometimes you call your parents and the parents is like, I don't remember, like, Mom, but you have me like 20 years ago.
20
They
years
forget.
ago. Exactly.
They
And 20
forget.
years ago, what she did for you is definitely not going to work for your kids today.
No?
No. I learned that the hard way. As
Okay.
I talk to the young people that I did raise, that the first thing they said to me is, if you want to learn something, you need to talk to me. You need to communicate with me, not yelling and screaming and hollering around the house, because I noticed that it just shuts down. So I had 2 children that I actually raised, and then I had my own that I used those procedures with. And I have to tell you, it's a definite relationship that I would want parents to have.
Oh, no, absolutely. Like you said, for me, it's like our kids are the best teachers of patience.
Exactly.
I was like, okay, let's go. But if they're in slow pace, if they are crawling, if they are, not everyone has the same speed or talents or strengths. So we just need to adapt. And one of the things, look, for example, this beautiful radio station, which, by the way, if you want your radio program, you can call Emotion Radio and have like a celebrity show here, just like Dr. Nancy. But to adapt, like, for example, to have these adaptations, have the distance, we just need to adapt. For me, a lot of people tell me, Gloria, Dr. Nancy, we have problems. It's like, are you healthy? Yeah, then you don't have problems. If you're healthy, all the rest of the things are your situations. We just need to get solutions. So, but tell us, what are the secrets? Tell us.
The one thing I will tell every parent, that communication is your baseline. You need to be able to communicate, not yell, scream, and holler around the house, not punish, because I realize with punishing children and you tell them to go sit in the corner and think about what they did, they don't even remember what they did, okay? So it's a form of communication. And the other thing that's important is patience. We all have a tendency that we rush through life and we need to get things done. And children are not on the same timetable. So the patience that you learn from a child, because you do learn, is that everything is going to get done, but it's just going to get done at a normal time.
So, yeah, that's a very good point, Gwen. And it's something that I've always said as well in my practice and what I've done and how I live my life is to stay present and and listen. And that ties hand in hand with patience. And if you are present and you're able to listen to what the individual is saying, no matter the age, then you're going to be able to effectively know what their needs are because you're listening.
Well, now that you say that, doctor, talking about patients and listening and communication, when I go to the doctor, they told me, okay, what do you want to have done so that I put you for a 15-minute appointment or a 30-minute appointment? What's the difference between Dr. Nancy and the 15 and the 30-minute appointment?
Well, I do work on a schedule as well, but it's not really about that at all. You come in and give a brief descriptor of what it is that you have concerns about, and we sit down and we figure that out before you leave. Now, if it warrants another follow-up appointment, then we take the time to do that. But I take the time to listen. And again, with my years of experience, a lot of individuals don't know what they are coming to you for, and they don't know what they don't know. And sometimes I think as a patient, to come in and be able to deliver some content and wait for the response back from the medical professional so that together you communicate and you collaborate and you coordinate on a plan. It's not a dictatorship. It is actually a truly a relationship that you develop a plan for.
And it's the same with coaching. Everybody gets coached on a different schedule. Somebody might be able to have 2-3 calls with you and that's it. So with me, I noticed that first I will allow you to give me that incentive. You get a free call to talk about why you want a coach and why you need a coach, because everything that happens with children in today's time, I might not be able to help you with, and I'm not here to waste your time. And if it's something that comes up that I'm not comfortable with coaching with, I will definitely select another coach, because I know coaches, they coach in different areas.
You make a really good point, too, about different types of personalities, and you have to know what your strengths are and your weaknesses are and know when to refer. Even in my specialty, know when to refer. You are not God, and you have to know what your limitations are in order to know what you are confident in doing and your strengths, because knowing what your weaknesses are is one of the greatest assets that you will find being a professional.
Yes.
That's great. We have about 10 team members on a regular basis in our agency. And every 3 months, we're doing a SWOT analysis to check what is your strength, your weakness, your opportunity, and the threats that we don't have control of. Because that way, we can complement each other. What I don't know, you may know. So alone, we cannot live alone. That's why they created the man, the woman, and then the animals, and because we know we need each other. So I think it's time to go to commercials again. And really quick, you said our guest next week is going to be Gary Charlson, right?
It's Gary Charlson, CEO and founder of ProFit Laser Lipo and ProFit Athletes Network.
No, that's great. Okay, so we'll go to commercials and we'll continue here with Dr. Nancy Knows. And remember, it's not what she knows, but who she knows. And we'll come back after a brief pause.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnanciesintegrativemedicine.com.
Te damos la bienvenida a las clínicas de la doctora Nancy. Creemos que la atención personalizada y la creación de relaciones son la base para mejorar los resultados de salud. En la medicina integrativa Doctora Nancy, obtienes un socio de atención médica que se toma su tiempo para entender tus necesidades de salud y encontrar soluciones. Ofrecemos membresías médicas opcionales que te brindan tranquilidad y atención de calidad. Tenemos servicios médicos y estéticos en 2 ubicaciones en Arizona. Practicamos los más altos estándares de atención al paciente. Respetamos tus derechos como paciente, protegemos la confidencialidad y tratamos a los pacientes con compasión. Llama ahora a la oficina para programar tu cita al 480-669-6452 o en línea visita nuestra página de internet.
DrNancy'sIntegrativeMedicine.com.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
Welcome back, ladies and gentlemen, at Dr. Nancy Knows. We are actually going to talk about our empowerment moment segment right now. And to do that, I have dedicated my show to every show to have a segment that brings real life situations relevant to the topic based on our guest, expert guest, or celebrity guest. And the delivery of that particular topic is going to be in Spanish, and it's Gloria Guerrara, my co-host, who's going to give some examples of how a life coach would be best used, and or give some examples of that coaching being effective and why it's so much needed in this time that we're living in. Gloria.
Bueno, muchísimas gracias, doctora. Entonces, para todos los que están escuchando en español, tenemos aquí de invitado a Gwen, que nos está diciendo qué es un coach. Y la doctora Nancy, bueno, está también teniendo un espacio en cada show que se dirige hacia la comunidad multicultural en español, y podemos ver los captions, y luego si se van a YouTube los podemos ver en inglés porque pueden cambiar el idioma. Vamos a tener la inauguración de la doctora Nancy a las 12. Va a estar Nick Larry dando autógrafos. Van a poder ver las diferentes formas de medicina alternativa que nos da la doctora Nancy sobre cómo puedo bajar de peso, cómo me pueden hacer un chequeo médico, si necesito agarrar el flu shot pero por la nariz, para que no me gustan, si no me gustan las agujas, porque yo no las quiero. También lo que es COVID testing con resultados inmediatos, y va a estar también en, si ustedes van con un competidor les cuesta de 150, 190, pero ¿por qué es importante tener un coach durante estos momentos? Ese coach, escuchábamos la palabra coach cuando a lo mejor íbamos a hacer deportes y decíamos el coach de básquetbol, el coach de voleibol, pero ¿cuál es el coach de vida? El coach de vida es aquel que tiene experiencia en manejar ciertas situaciones, un divorcio, una adopción, la muerte de un ser querido. Ahora que estamos en la pandemia, por ejemplo, ¿cómo hablarle a esas personas? Y a lo que comentábamos un poco en el segmento anterior es, ¿qué nos han dicho las personas dedicándonos a lo que es el área de proteger a lo que más aman, que es su vida? Y la gente se ha quedado sin trabajo, no puede trabajar, a lo mejor porque se enfermó. ¿Cómo les podemos ayudar? Como la doctora Nancy comentó hace rato, con disability, que es algo que es, protege tu cheque. ¿Por qué? Uno nunca sabe si nos va a dar COVID, si nos va a dar influenza, algo que nos pueda dejar de trabajar. Entonces, protección al cheque es algo súper importante porque tú eres tu mejor activo. Entonces, ¿qué mejor que tú estar protegido? Tus hijos te necesitan, se lo debemos a nuestra familia, se lo debemos a nuestros hijos, a la comunidad, de que no estemos haciendo car washes, no estemos haciendo donativos o taquizas o fiestas para juntar para un funeral. Eso no es necesario. Las dos cosas que tenemos que hacer en la vida aquí es pagar impuestos, estar bien con el IRS, y tenemos que estar bien con nuestra familia, porque pues allá arriba saben que somos una persona de fe, pero Dios se encarga de cuántos años vivimos. Ojalá vivamos 100 años o más con los tratamientos de la doctora, que sean naturales. Es la forma más natural en lo que se especializa. Es una doctora, también puede prescribir, pero en lo que ella se especializa es de la forma más natural poder tratar a las personas. Entonces, ¿por qué llamamos el momento de empoderamiento? Porque es para comunicar a ustedes información útil, y pueden hablamos un poquito en inglés, hablamos en español y después ustedes pueden ver la repetición. Se pueden ir a YouTube y pueden cambiarle el idioma y ahí lo pueden ver en español o en inglés. Entonces, el tener un show con una doctora es algo padrísimo, que ella quiera dedicar esto a la comunidad. Acuérdense de estar hoy en la inauguración, ahora sí que más o menos en unas 2 horas y 15 minutos, en la dirección de Scottsdale, ahí donde está Tatum y Bell. Va a haber un poquito de música. Va a haber algunos vendedores de cosas que ofrecen sus servicios individuales, pero lo más padre es que vamos a conocer la clínica y qué ofrece cada especialista. Si ofrece un masaje, si ofrece perder 2 centímetros de gordura, esa lonjita que no nos gusta, o si nos queremos embellecer, va a estar Maggie Girón, la maquillista artística especialmente, que por cierto le damos las gracias porque hoy a todas nos dejó, we look like dolls because of Maggie, right? Entonces, este es el momento de empoderamiento, pero vamos a regresar con Gwen, que es nuestra coach, para que nos diga, como ella dice, ok, ¿qué es coaching? ¿Qué significa coaching? Y cómo hablarle a la familia ahorita en estos momentos de pandemia. So, Gwen, let's go back, Dr. Gwen, let's go back to what is a coach, or what does a coach like you do?
I am a coach that coaches parent and children relationships to help keep the connection. A life coach is an individual that will help you get out of your heads with your, I should say, your thoughts and growth, and move forward with your lifespan. But there's different ways of doing that. So as a life coach, what I actually do is help you to take those steps forward in your dreams, which is most of the time gets lost, and make them grow.
Okay.
So, but the thing that I wanted to say, that life coach, that's exactly what it is. I will be your coach for life throughout the growth of your child.
So, do we need 1 session, 2 sessions? How do we talk right now with the kids? You know, that they are like, some of them are trapped in house. I can talk personally.
Yes.
For example, my son, since March till now,
Mm-hmm.
he doesn't go out. Only when we go and pick up the supermarket, because we are like online pickup, because he's a special needs, so he's high risk. And then that's his outing, and he's like, okay. I hear a lot of people complaining that, oh, I'm tired of being in my house, and I just ask, aren't you working to pay your house? And they say yes. So
Yes, the pandemic drew us together whether we wanted to or not. And it's just another form of adapting to something else. As parents, we are strictly routine. Our routine runs, you get up in the morning, you fix breakfast, you drop the child off at school, you go to work either in your house or at a job. You come home, you cook dinner, you do your help with the homework, you talk with your kids a little bit, and then they go to bed. Well, the routines change. So
Give us some tips on how you
this
suggest.
is what I wanted to say with the parents. Make sure that you sit down and talk to your child about the disease itself. Don't make it drastic. You can just tell them what it's all about. And in that process, you can tell them if they have any questions about COVID or the pandemic or whatever, to come to you. And that builds the trust between you and your child. The other thing is that you need to change your routine. You know, I know you have to work at home. There's a lot of people working at home. Kids are online. So I look and say the thing you need to talk to your children about with this disease is how to keep safe. Washing hands for 20 seconds. And a lot of kids is like, washing hands? Make it a game. Sing a song. I use Happy Birthday, you know, but whatever song works for you to make them wash their hands. How to cough into their arm. How to stay distant from people that you don't know on the outside. You don't have to become a hermit because of a pandemic. The other thing is to create healthy habits. Eating well, activity, and communication. And that's communication with people outside of your home, like your family members and your friends. You have FaceTime, you have Skype, you have Zoom. You should just make it a routine that maybe we'll make a call to grandma, and not 2 days a week, but maybe 3 or 4 times a week, because grandma's not busy either, you know. And the one thing that I want to stress, besides finding other things to do, is as a parent, stay calm. Just take it step by step and take care of yourself. Because if you don't take care of yourself, you can't take care of your children.
That's exactly right. You know, my motto is make yourself a priority. And
She does.
so you have to take care of yourself in order to take care of others. So it's that, you know, plain situation. You strap on your oxygen first and then you can assist.
That's
So
a very
definitely.
good comparison. Strap your oxygen first.
Yes.
And Coach, how do I tell if I'm sick and I'm in my 40s and my mom is in her 60s? How do I tell them I have a bad sickness?
Well, you don't have to scare the child. You tell them exactly what you have. I have COVID, and this is the effects of COVID. Don't go around saying, I have COVID and I'm going to die in 2 weeks. No, not necessary. You know, I have this. This is what I can do, and this is what you can do to help me get through this
So
sickness.
That's an example of what you're saying as a parent is to stay calm and
Stay calm.
control the situation, because kids are very intuitive.
Yes.
They can pick up on your energy.
And just make sure you keep that line of communication open.
And for example, my mom is in Mexico. She calls me every week. If I were to get sick, if I have cancer, talking about Cancer Awareness Month, how do you tell your parents? Because I think my mom is older, we're far, and it happens to a lot in our community. A lot of the parents are far. How do I tell my parents? Just like you mentioned how you tell your kids, but how do I tell my parents that are older and the least thing that they want is for me to have anything bad going?
Of course, parents want you to be as healthy as can be, but you would treat your elderly parents the same way you would treat your children. You would tell them straight up what I have and what I'm doing and how I'm being taken care of.
That's that peace
Reassure
of
them.
mind. That's that peace of mind. I believe definitely. You know, if your parents, all they want to know is my child safe?
Mm-hmm.
And if you give them peace of mind, and you do have to be a little bit specific about reporting about your whereabouts and what you're doing, but every parent is different, and if they're specifically asking you for certain things, then you deliver that information to them to give them peace of mind.
Yes, you do. Because it's worse if you, like you said, get cancer, and then instead of going in the right direction, it's went in the wrong direction, and then they would feel so bad that you didn't tell them.
It's because sometimes we don't want to worry our parents,
No,
right?
No child wants to worry the parent, but if you tell them straight out what's going on and how you're being taken care of, and instead of once a week phone call, make it 3 times a week. That way, for me, I'd like to hear from my daughter more often, and that way I could tell whether or not she's in good health. But I just talk to them, and that's another thing with the communication.
So I think that's a really good point too, Gloria, that it's not always, it is the parent-child relationship, but the time continuum can be very different. But the requests and needs are about the same.
Exactly. And I think what I do with my parents, that I talk to them, because my business is GSJ Coaching, and I use the initials specifically for growth, strength, and journey.
Awesome.
So when I talk to my parents, I always tell them, let's grow on our strength on this journey of life, because that's what it is.
I love that. I love that. How can people reach you?
I can
Gwen?
be reached by phone. I have a website, which is gsjcoaching.com. And I also do coaching over the phone also.
I
Now
was
with
going to ask
technology,
you.
right?
Yes.
Yeah, with the technology, do you do telemedicine or the Zoom, other ways to communicate with
Well,
you
now
as well?
with the pandemic, I do Skyping and Zooming, but I find that it's a lot more beneficial for parents to work in a group, like my Lunch and Learn workshop. Because the problems that come up with children, yours might be just for your household, but then you don't know if the person next to you has a different type of problem that might. And in that Lunch and Learn workshop, all of that gets not resolved, but gets exposed and talked about.
I love that idea about the group dynamic, and actually things work themselves out when individuals divulge and share ideas. Everybody has a situation and or a story.
Yes.
You never know what one person's story can help resolve another person's concern or issues. Yes.
And Coach, when you mentioned, just give us like 2 tips, because I know that we have limited time.
Yes.
You mentioned that you had best practices with your kids and that they are wow. So what are
I
the
am
top
very
3
proud. All 3
best
of
practices?
them I'm very proud of. I didn't think 2 of them were going to make it to college, but they did. But all 3 of them has graduated from college. And I think the reason why parents get drawn to me, because 2 of them I actually raised as a single parent. And through that, raising them as a single parent, I learned my mistakes. It's very hard for parents to admit they make a mistake, but I've learned that yelling and screaming just turns them off, and they are now beautiful, all 3 of them, beautiful kids.
So what were those best practices? What did you apply?
Communication. I learned to sit down and listen to what they had to say. And it's very important because kids do talk a lot. And a lot of times they repeat themselves. And parents are like, oh, you already told me that. I already heard that, It doesn't matter how often they tell you the same story. It's just the fact that that's their way of preparing you to listen to them.
Wow. Congratulations, single parents. I'm sure there's a lot of single parents listening to this. And it's hard.
It was, and plus I was younger too and didn't know. Like I said, I tried to raise them the way I was raised, and that wasn't working too well. So what I do offer is in coaching, there's always sessions. There's 6, 12, and 24 sessions. And those 6, 12, and 24 sessions aren't used at one time. Today you might need 2 days. Next month you might need another day. So that's why they call them session instead of daily.
Well, that is awesome. Thank you so much, Gwen. You really made some very valid, important tips that I think that all of my viewers can really take to heart and disseminate and use within their own families, actually, to grow their bond and make it stronger and communicate more effectively, or just consistently with their loved ones and children.
Oh, no, thank you. Wow. Great. I'm great. I'm impressed, and thank you, Dr. Nancy, for bringing Gwen. It's good that you're always going to trainings, meeting new people. So you're at the edge of your career, and I appreciate all the. We need more.
Yeah,
I'm sure that we will have you
me.
more. Yes. So
Yes.
we have 1 minute, Dr. Nancy.
Yes.
Yes, we don't know who our winner is for the rapid COVID test, but Facebook, we will let you all know next week. But remember, later this afternoon from noon to 4, we are having my grand opening, Dr. Nancy's Integrative Medicine, at the East Bell location in Scottsdale, Arizona. Live music, giveaways, rapid COVID testing, flu vaccines as well.
Massage.
And yes, we are having chair massages and beauty, aesthetic services, along with medical services that are available for, making an appointment and purchasing. So come out and support and join us and have fun. Oh, and next week, of course, we're going to have Gary Charlson as our guest expert, who is going to give us some more information about laser lipo, ProFit laser lipo, and how to lose those inches, ladies and gentlemen.
I want to be the first client.
So thanks for having us, and listen, enjoy the rest of your weekend. Remember, be the change that you wish to see in this world, and it's not only what Dr. Nancy knows, but it's who she knows. Thank you so much.
Optimal health requires you to perform at your peak potential. Start today. Be the change you wish to see in the world. This was Dr. Nancy Knows. Thank you for connecting. We're waiting for you on our next broadcast here at EMR, eMotion Radio.